Greetings, my fellow YouTube nurses. Are you guys ready for my first semester students who's going to start in January, ready to start second, third, fourth semester, and my fourth semester students who's going to be graduating in 3 weeks to pass their nursing school graduation NCLEX and ready to get a job? Woo! I don't know how I did that. It's my ADD kicking in. I'm just going to roll with the punches. Alright, I know as random as I can get sometimes. I love how you guys roll with me. Follow me on YouTube, subscribe, all that good stuff on Twitter and on Instagram. Yeah, so let's talk about it, y'all. I know the world's probably going to end in like 21 days, but who cares, right? Who cares? As long as you believe in yourself and in God, you're good to go. So, let's talk about the good stuff. My first semester students and my fourth semester students. I got a question talking about what to expect for first semester, and I got another question from another person who's going to graduate in like 3 weeks. Congratulations! What to expect after graduation, fourth semester, NCLEX, and so forth. So, first semester, when I first got in there, I remember I got my paper, I was like this. What? Woo! I started getting happy. I was jumping up and down like a little dumb kid, running up the steps and just yelling and telling everybody I'm going to nursing school. And then I realized once I got into nursing school, it was no joke. This is your life, ladies and gentlemen. This is your career. This is what you want to do. And this is what you got to take serious. So I realized you can't fail this and take it again. You can't say, oh, I'm going to take it later and, take a test and pass it. No, this is all about here and now, present. You got to start busting your balls and studying hard for your school and what you want to do. Very important because this is your life career, right? So I realized when I first started, oh, and by the way, guys, I'm throwing in some Christmas music, so just kind of bear with me. I'm trying to get in the mode, y'all. I'm getting in the mode. I don't know why I'm doing this, like I'm massaging something else that I shouldn't say. But anyway, y'all, first semester is something that you start enjoying because it's the fundamentals of nursing. You start learning to do vital signs, starting to learn how to do bed making, you start doing sub-Qs, how to insert Foley catheters, using stereo technique. You got the instructor there, you start learning your first PCR, which is patient care review, patho paper, and then you start doing your care plans. Show! I hate care plans to this day, I don't like them, but you gotta learn how to do them. I think I got a care plan here somewhere. No. Here we go. Bam. Care plan right there. I don't know if you guys can still see it, but that's my care plan. That's my very first semester care plan, my very first care plan. I'm not taking that off the wall. That's like my first picture I drew in the kindergarten you put on the refrigerator. Well, that's kind of like my first picture, but I'm leaving it right there. I don't take that off. That's just memory lane right there. And so anyway, first semester you can do your care plans and so forth, and you can actually work in first semester. So everybody out there who's starting school next semester and nursing school, congratulations. And first off, I want to talk about the fundamentals you're going to learn. So you're going to learn how to do bed making, like I said earlier, and the basic vital signs in your first couple fundamentals, which is like the systems, endocrine, pulmonary, cardio, musculoskeletal, the GI tract, and so forth. So you're going to learn a lot of basic stuff, and you start realizing, wow, this makes sense. You're going to start having epiphanies. Like this goes to this, the system goes to this diagnostic and this lab go together. So you start putting and piecing the things together. It's kind of like you're a detective. It's actually really cool. You start putting everything together and things start making more sense. I loved it. And I remember when I first started, I had my scrubs all clean and iron. I was ready to go. I had normal sinus, all happy. And then when I first had my exam, boom, sinus attack. Boom, anxiety. Boom, I started to sweat and die for a reason. It was bad. It was bad. But that's just me. It's different for everybody. And then you start realizing this is your life. And you start shutting everybody down, like your family. I know it's bad, but you shut everything down. Family, friends, your phone, internet, anything. Because you start realizing this is a need to do basis. Like, you need to learn all this stuff. This is basically do or die. You start eating, breathing, pooping, living, nursing. No lie, y'all. No lie. No lie, no lie, no lie. So basically nursing school becomes your baby. You gotta nurture that, feed it, take care of it, change the diaper. I mean, you gotta learn everything about nursing. You gotta nurture your first, second, third, and then when you graduate, fourth semester. And then after that, y'all, when you guys hit fourth semester, graduate, NCLEX, pass that, get a job, and you're working, making good money, and doing what you love, which is taking care of patients and doing your holistic care. So that breaks down first semester, y'all. Now, fourth semester, I had a question talking about what to expect, what do you do? So fourth semester, it's kind of a breeze, but it's not. It's a breeze because you're just following a preceptor and they overview and they see what you do and they basically get feedback on how you work independently in the hospital, and they send to the instructor your overview of, of your different things that you do. If you're able to pass meds independently, how you do an assessment. Basically, they're your eyes, and they give it to the instructor, and they'll give you an A or B or whatever. But fourth semester is awesome because you're working on your own. You work from your first, second to third or fourth patient, and maybe you can go with 5 patients on your own. But it's beautiful because you start learning to time manage and you start learning how to do everything independently, y'all. So fourth semester it's easy, but it's not, because you're learning how to become a functional, proper nurse. And I loved it because I remember when I first started, I had 1, and then I worked my way up to 2, and then 3 patients. Once I hit 4 patients, I was struggling. I only did like 2-3 days with 5 patients. That was very, very hard. And then I kind of worked my way up from there. But it's awesome. I mean, it's a beautiful experience because you're learning how to properly manage your time and pass the medications and chart and document. And it's a beautiful feeling. I loved it, loved it, loved it. And to this day, you know, after I graduated, passed the NCLEX, started working nights, then I went to days, and now precepting is just, it's a beautiful feeling, and I love helping people. It's just something I like to do. So, my fellow YouTube nurses, hopefully that ends it on the 4th semester. And like I said, guys, focus on what's going on now. For my first semester students, or any semester you guys are in, focus on what's going on now, present. I hate when you're in school and you're like, oh God, I have to worry about that test next week. I mean, not next week, like next month. Or I have to worry about 2nd semester, 3rd semester, or my NCLEX. Don't worry about any of that stuff until you get there. So you worry about what's going on now, okay? Basically, live the present. That's how we're supposed to do it anyway. Every day, live what's going on now. Don't worry about the past. Don't worry about the future. Worry about what's going on now, okay? So I'm going to end it on a good note. And here's a quote of the day. We're very, very, very simple. It says, nothing is impossible. The word self, it says, I'm possible. So marinate on that. Think about it. Write it down. I don't care. All right, my fellow YouTube nurses, have a wonderful night, good evening, good morning, good afternoon, and so forth. Don't forget to follow me on Twitter. Don't forget to hit up the like buttons on my YouTube channel and comment, all that good stuff. And Merry Christmas, Happy Hanukkah, Happy New Year's. And yeah, thanks for everything, guys. My fellow YouTube nurses, Merry Christmas. I'm out.